Hello, ma'am. So, unfortunately, we have some bad news. The test results came back, and you do have uterine fibroids, so we don't think that you'll be able to conceive. Sorry.
Have you or anyone you know been diagnosed with a reproductive disorder such as ovarian cysts, cervical polyps, or uterine fibroids? You are not alone. Studies have shown that millions of women around the world suffer from one sort of a female disorder or another, which may affect their childbirth process. But do not be afraid, help is not far away. It is your duty to learn the warning signs that may be associated with the reproductive disorder because it could save a life. To learn more about female reproductive disorders, call 1-800-DISORDERS or visit the cdc.gov website.
Hi, this is Poonam.
And this is Andrew.
Today we're going to talk about the cervical polyps. So what is cervical polyp? Cervical polyp is a smooth red finger-shaped growth in the cervix. It is usually due to inflammation, infection, or increase in estrogen level. There are two types of cervical polyp. One is ectocervical, which is usually seen in postmenopausal women, and endocervical, which is usually seen in premenopausal women. So cervical polyp, it is usually benign and non-cancerous, but sometimes it might be a cancerous too. And what are some causes and risk factors? So some of the causes, usually it is unknown, but it is suggested that some of the causes are chronic inflammation and infection in the cervix due to STI, and abnormal response to estrogen, which is increased level in estrogen, or if they have a complication during pregnancy. And some of the risk factors are usually in multigravida who are aged between 50 to 60, and sexually transmitted infection, and who have a previous history of cervical polyp. And on the assessment, what we are looking for? So we are looking for if they have any heavier bleeding during menstruation, if they have a bleeding during sexual intercourse, or if they have a bleeding after menopause, and they might also have an abnormal discharge like yellow-white discharge, which is due to an infection.
Okay. Now for the interventions, you'll mainly want to deliver NSAIDs to relieve any cramping the mother would have. You'll also want to prepare some pap smears to check if the polyps are cancerous in any way. And if they have removed the polyps, make sure you use pads and not the tampons. Now, cervical polyps have been shown to be connected with inflammation, infection, and infertility. This is due to them blocking the cervical pathway. And it has also been connected to preterm birth and miscarriages, especially the decidual ones.
Hi, my name is Gwen.
And I'm Desiree.
And today we're going to be talking about ovarian cyst. So an ovarian cyst is just a fluid-filled sac or pocket that can be found in an ovary or on the surface of the ovary. And it can be categorized into two types. We have the functional and we have the pathological. So the functional is basically just, it can be connected to your menstrual cycle, and it is usually harmless, and it rarely causes pain compared to the pathological, and it usually disappears on its own. We have the pathological. The pathological is not related to normal function of the menstrual cycle, but is related to abnormal cell growth, and it can be divided into three things. We have the dermoid cyst, we have the cyst denomas, and we have the endometriomas. So for the risk factors, we have patients on or women on infertility treatments such as like gonadotropins. We have tamoxifen, which is an anti-estrogen medication. Patients that are pregnant, patients that are going through hypothyroidism, postmenopausal women, women that smoke, and also it was seen that tubal litigations were associated with functional cyst. The signs and symptoms just include pelvic or lower abdomen pressure or pain, painful periods, urinary urgency, urinary frequency, pain in ovarian torsion, and hemorrhaging related to cyst rupture.
Okay, and for your assessment, you're going to want to assess the patient's pain level, the location and the quality of the pain, and the gold standard for diagnosing ovarian cyst is a pelvic exam with an ultrasound, and the impact on the reproductive health. It can result in abnormal ovulation, which of course make that harder. Interventions, you're going to want to obtain a CBC and a urinalysis just to rule out any other causes of pelvic pain. You're going to want to administer analgesics for pain, and you want to prepare the patient for surgery if that's indicated. And the indication is if the cyst is too large or persistent, you're going to want to get rid of those via laparoscopy. And the impact on the fetus, newborn, or fertility. Cysts caused by endometriosis and PCOS are linked to infertility. They can also cause ovarian torsion when they get too big, and they can cause an obstruction.
Hello, my name is Ife and this is Ruth. Today we'll be talking about uterine leiomyomas, also known as uterine fibroids. What is uterine fibroids? They're single-celled monoclonal tumors that can be found in the outer layer of the smooth muscle of the outer layer of the uterus. And what are the causes? Researchers have found the causes to be unknown. What are the risk factors? The related factors to the uterine fibroids are age, genetics, increased age, genetics, hormones, the estrogens in particular, and women, African American women. And what are some assessments that you carry out on a patient that has uterine fibroids, or what would you see in a patient that has uterine fibroids? They'll complain of abnormal uterine bleeding, pelvic pain, difficult or painful sexual intercourse, back pain, constipation, infertility, and heavy menstrual bleeding. Heavy menstrual bleeding is the most common assessment or the most common symptom you find in a patient with uterine fibroids. Ruth will be telling us about some nursing interventions that we can carry out to help these patients.
Awesome, thank you, Fred. So first of all, you would want to treat the underlying cause of the problem for uterine leiomyomas. So like as she said, bleeding is the major thing that would cause uterine fibroids. So we'd want to treat those with the use of NSAIDs or antifibrinolytics and contraceptive steroids. Also, you would want to use some imaging techniques to diagnose this, such as ultrasound for diagnosis. We would also want to try some surgical treatments, such as hysterectomy or myomectomy. And we have types of those surgical treatments. We have hysteroscopic and laparoscopic, which is the standard form of surgical treatment for uterine leiomyomas or uterine fibroids. Also, we can use some analogs known as the gonadotropin releasing hormone analogs. And we can also use selective progesterone receptive modulators, which are good for correcting anemia and also help in shrinkage of those fibroids. They are way effective for that one. So how would this impact, or what impact would this have on the reproductive health? Well, for one, fibroids can lead to infertility, but that doesn't mean that the person would not still be able to get pregnant with this condition. She still has the possibility of getting pregnant. Also, the pregnancy hormones can cause the fibroids to get bigger, hence this might affect the position of the baby, hence turning the baby into a breech position or a breech presentation. This has an effect on the mother's reproductive system. How about the baby? The fetus, what impact would that have on it? This may also contribute to infertility, like we said. The baby might not be able to be born or be brought to this world. Also, it could lead to preterm birth, basically. and it increases the risk of miscarriages for that baby.
If you have any questions, contact your healthcare provider.
Thank you
Thank you
for
for
watching the
watching.
video.
Oh my god, I look so cramped!